forecast. As COVID-19 spreads in jails and prisons in Indiana and across the country, the death of a young pregnant woman really drawing attention this morning in the debate over releasing inmates to home confinement. Jessica Jackson is Chief Advocacy Officer at Reform Alliance and co-founder of Cut 50. She is one of many who's been sounding the alarm on the need to reduce jail and prison populations. Jessica, good morning. First, I just want to get right to it and ask you your reaction to this woman who just died. And do you know how her baby's doing?
This is just devastating. I mean, my stomach was turned when I heard about this. You know, this is a young woman who was serving a 26-month sentence for letting somebody sell drugs out of her house. She gave birth to that baby while on a ventilator for COVID. And instead of being sent to home confinement where she could have avoided ever getting sick, she died in prison. And now that baby is going to grow up without a mother.
I know that there was a prosecutor in Arizona that is claiming that folks like yourself are stoking fear and trying to manipulate the criminal justice system. For those that agree with her, what do you say to defend your opinion?
Well, I think this is a very real threat to people, both inside of our prisons and outside of our prisons. And we've got a perfect case study in the prison of Marion in Ohio, where they had 2,500 people who are incarcerated. They did mass testing, tested every single person. 1,843 of them, over 70%, came back positive for COVID. And what we're seeing now around that prison is that because the guards and the staff are in and out of that prison, it's seeping into the community. There was just a big story about it. So this isn't just impacting people who are behind the walls. This is a public safety issue for everybody in the local communities. And if we don't let some people out so that they can safely distance inside and get the PPE that they need inside, we're going to see jails and prisons become accelerators all across the country.
Attorney General William Barr ordered the Bureau of Prisons to release nonviolent federal inmates to home confinement. We know some are being released. There are also lists that were posted at prisons across the country and even here in Indiana. I've talked to about 12 of them, their families. Those names of men and women were told they were going home, and then the rules were changed. So many people frustrated by that and really saddened. Why the back and forth, and what is the latest?
Yeah, again, this is absolutely heartbreaking. People were told their loved ones were going to come home to home confinement and be able to serve the rest of their sentence there where they would be safe from this virus. And then they were told when they got there to pick them up, actually, no, your loved one is not coming home. So there's been a lot of unclear guidance coming from the DOJ to the BOP. The most recent is that they've come up with criteria as to who can go to home confinement. But out of a system of 176,000 people, it only applies to about 200 people who are incarcerated. So it's simply not enough. They're not taking this seriously, and they're not acting fast enough. And I think we're going to see a huge public health crisis because of it.
For those that are, I'm out of time. Sorry, I just got that word. I wanted to see, we'll put up some information though, hopefully. We're getting bombarded by people that are asking, what can we do? Is there anything we can do? I'll try to get them to Reform Alliance, so maybe you guys can help them out. We appreciate it, Jessica.
Thanks.